The Loma Linda University Neuropathic Therapy Center is a research treatment center for neuropathy. It's the first of its kind where we bring a manual therapy treatment that guides circulation directly into the nerves. The center is dedicated to stopping anything that creates neuropathy as well as reversing neuropathy using this modality, intraneural facilitation. I have two boys that have special needs. I started looking at ways that I could naturally reduce inflammation, the anatomy of the nerve, and I realized I was able to create a vascular response by doing certain holds and positions. And that vascular response was distal to where I was treating. I would, for instance, do a certain position and a patient would say, wow, I'm feeling this flow of blood, I'm feeling increase in my, even in my symptomology when I did this hold and position, and then when I stopped the hold and position, all of a sudden it would go away, and it was almost like a faucet was being turned on and off. With intraneural facilitation, we first engage the circulation by stretching the artery and the nerve together, and now circulation is optimized between the artery and to the nerve. Once that occurs, there's two compartments. The first compartment is pressurized. Now there's a release system, and so we can release by stretching, say, the skin of your foot where you're having your symptoms. We can stretch the skin of your foot, and that pressurized flow is then released into your foot. There's a whole system to make sure that that circulation that's now released into your foot is engaged with your larger neurovascular circulatory system.
It's been great. I came in about 3 years ago and had some pretty extensive treatments that really brought me back from walker and cane to being able to walk without a walker and cane for about 3 years.
15 months ago, I was going 60 miles an hour on skis, and I snapped my leg in half and had significant neurovascular trauma. Knowing about our neuropathic therapy center here on campus, I reached out to Mark Bissell and asked if he thought he could help. And upon reviewing my case, while it was a unique case, he did feel that the therapy would provide benefit. The one therapy that I've been very diligent and consistent in is the intraneural facilitation therapy, or what I call Mark Bissell's special magic. In addition to the standard routine therapy that I've done, which has ultrasound Doppler velocity evidence that when I go through therapy, I have additional blood supply via the neuro pathways because my arterial supply has been damaged. So we're getting blood supply to the tissue that needs to heal, including the nerves via the nerves themselves. And I can tell you that during therapy, you can actually feel it occurring.
The clinic here is really collaborative. Everybody has a feedback and everybody has a say, and if something's not working, we want to take a look at why. I've seen patients who have had a 0 on their EMGs as far as nerve conduction test to go back to normal. We've had people get off of or get out of wheelchairs and start walking and return back to normal life, and yeah, I've seen some pretty amazing things here. The nutritional piece is kind of interesting because there are some proteins that are in foods that can be neurotoxic or slow the healing process down. And so by systematically eliminating them or restricting them, we're actually allowing the body to start regenerating, if you will.
I started coming to the Loma Linda Neuropathy Treatment Center about 2 years ago. It has been a blessing. It's been a life changer for me. I don't remember how long it had been since I could actually feel my feet or feel the floor, feel warmth in my feet. And after the first treatment, when I got off of the bed and hit the floor, I could feel the floor. I could stand straight. I could walk straight without holding onto the wall, and my feet were warm. I could just feel so much warmth in my feet, and that was after the very first treatment, before I even left the treatment room.
There's nothing worse than feeling a loss of hope or hopelessness, or this is my reality. And to know that there's other therapies available, such as intraneural facilitation, which is a therapy not offered everywhere. In fact, it's offered in very few places. I feel very fortunate to have developed a relationship with this clinic and with Mark Bissell, to be able to have the experience of this therapy and the ability to be healed in multiple different ways.
We're looking at 30 million people just in the United States. And worldwide, it's hundreds of millions of people that have this. And we've been approached throughout the world to train and to bring this to other centers and to other practitioners around the world. And that's exciting. We want to have this to be a global phenomenon that starts right here. The vision for the future for this therapy is for Loma Linda to have multi-center, multi-site research, to bring this with other academic centers and to teach the instructor how to teach other students how to do this. We feel passionately about research, we feel passionately about developing new technologies. We're the only place that does this, and we're excited to be at ground zero for this therapy.